Dr. Troskie. I'm an orthopedic surgeon at Worcester Provincial Hospital, and we are also part of the Ukwanda rural campus. I think rotating at Worcester Hospital in your 6th year, or working at Worcester Hospital in your 6th year, has got definite advantages compared to the Tygerberg rotation. First of all, because the groups are much smaller, it's a more one-on-one contact that the students will have with us as consultants, as well as with the medical officers who they work with, and therefore I think the learning chances of actually learning is much better than one would get at Tygerberg. Another advantage of the Worcester Ukwanda rotation is the fact that we have dedicated OSCEs covering the most important part of the syllabus to make sure that the students really get a hold of orthopedics, get a better picture of what is important in orthopedics. Orthopedics is a very wide field, and it's impossible to cover all the topics that is in the syllabus, but we really try and concentrate on the really need-to-know subjects that the students should know.
Tell us a little bit more about the longitudinal program.
Yeah, the longitudinal program, unfortunately with the longitudinal program, we obviously have much less student contact than with the limb students that comes to us for 5 weeks. And with the fact that you have less contact during that period, obviously it's more difficult to really gauge where the students are in their knowledge. If you work with a student for 5 weeks non-stop, you really get to know the student very well and know the weaknesses and the strong points of the students. While if you just see them every 3rd week in the limb program, it's much more difficult to really get an idea of where they are with their knowledge, and therefore you unfortunately only realize where you are when we get to the midterm exams or the midterm OSCEs. So I think the limb model has got its challenges, and I think the major challenge, especially in orthopedics with the limb model, is the fact that the practitioners working in the peripheral hospitals that's supposed to teach these students about orthopedics sometimes don't have the basic orthopedic knowledge needed to really teach other people in orthopedics. And that would be my feeling why there's a shortcoming there. Obviously with the fact that they rotate with us every 3rd week, we try and fill those gaps every 3rd week, but it's a very, knit one, slip one type of situation, so it's difficult to really get the same amount of information over to the student than with students that work with us for 5 weeks non-stop.